Welcome back to the FDM Academy channel. Today I want to talk to you about what is FDM. I want to go beyond the textbook definition of FDM and give you some ideas on how you can explain it to patients and colleagues. So stick around and we'll talk about just what the FDM is. So what is the FDM? The textbook definition is an anatomical perspective in which most musculoskeletal conditions are envisioned of consisting of one of the 6 fascial distortion types, each of which has a signature clinical presentation. Okay, so that's great, but what does that mean? That's very ethereal. So first, let's break down the 3 words of the fascial distortion model. Fascia, that ubiquitous tissue, that shiny membrane that covers everything. And in a future video I want to talk about tensegrity, because to me the fascia is the tension in our system. Next, distortion. Not everybody understands distortion. It seems like a kind of traumatic word, but it's distorted, disrupted, damaged, somehow altered. And then a model. What is a model? It's an anatomical perspective or view of the body that's hypothetical. It can't be directly visualized. That's one of the things some of the opponents of the fascial distortion model say it's too theoretical. Well, that's the definition of a model. It is theoretical. In medicine, we operate under many models. We have an inflammatory model. We have the cardiovascular lipid model. We have a lot of models that become so ingrained in our culture, we don't even realize they're models. So we have fascia, we have a distortion or alteration of the fascia, and then we have a way of viewing that. What Dr. Topaldis gave us was a system of looking at what our patients are presenting. They're telling us what's wrong with them. Such a historical comment that we get in training. Listen to your patients and they'll tell you what's wrong. Dr. Topaldis gave us a framework to listen in. So each signature distortion, each of the ways you can mess up the fascia, has language and physical gestures that are associated with it. So as we watch our patients during a patient visit, they give us the clues, they give us the knowledge that we need to guide our treatment. To the patients, it's actually one of the few times in medicine where they're actually listened to intently and they feel as though their input matters. A key tenet of the model is that the patient is the expert and they intuitively know what's wrong. In order to be fixed, we have to listen to them. So as we listen to our patients, we watch the gestures, we hear what they say, and that guides us. That is what the model is. We're going to use our hands to treat the patient, to remove the fascial distortions, allow a patient's structure to return to a more normal function, which thereby improves function and range of motion. As an osteopath, I firmly believe that if I can improve a patient's range of motion and function, they can heal themselves. And it's that self-healing property that makes an osteopath's mind a little bit different than some of our other medical colleagues. I'm not fixing anything. I'm allowing their body to fix itself. That is the model. We have fascia that gets altered and we fix it through improving a patient's range of motion and function. Thanks for listening, and I hope you'll join me next time. Stay in the model.